takes a team. It takes a team to run your business. It takes a team to do healthcare. It's too complicated. There's patient feedback, and there's publicly available information. So you know which hospital's doing what, you know which doctor's doing what, you understand, and people are held accountable just like they are with all the rest of our businesses, right? So we formed the Patient-Centered Primary Care Collaborative that I'm the president of. It came out of that meeting in Washington between the buyers and the providers. We now have over 800 signed on members. We have most of the Fortune 500. We have all of the primary care organizations. In fact, the leadership of them are all on my board. We have all the national payers, and we have lots of patient consumer groups involved in it. A year into this, the primary care organizations and the companies again got together, and we invited all the healthcare plans into the room. And we said to them, you're going to do pilots around the country in this. You're going to do them together as multi-stakeholders, right? You're going to actually get together in the communities. You're going to talk to each other, and you're going to do a pilot. You're going to do it with Medicaid. You're going to do pilots across the state. And the one of you who hasn't, right, hasn't started this in a year, none of us, 47 companies, are going to buy from you. We're going to stop. So one of the large companies didn't really pay close attention to that. I took him to the New York Times in the woodshed, right? And they started doing pilots. They now have 4 of them, right? So those are the multi-stakeholder pilots that are happening across the country. We're beginning to see results for that. This is results from central Pennsylvania. This is one that was called a Proven Health Navigator. And again, just like in South Carolina, you know, we're seeing a 9 to 10% reduction in overall cost, and we're seeing a reduction in ER visits and hospitalizations. I visited a practice in Florida 3 weeks ago, a young pediatrician, Javier, and he's now in his 5th year of a medical home. And he's gone from having an average of one, he's a pediatrician, he's gone from having an average of 1 sick kid hospitalized for asthma a week. Half of his population are Medicaid, so it's a poorer population, to none in 19 months, 0 in 19 months. Why? Because he's paid attention to details. I sat in his office and I watched what happened. You know, a mom emails him and says, you know, my kid's having this and this, and all of a sudden he's empowering them to up their medication. You know, he's empowering them to really get better control. You do that a couple of times and all of a sudden the patients begin to be more empowered. They don't even email anymore, right? They now know that they can do this, right? I mean, it's just enhanced communication. That's what I want to buy. I don't want to buy anymore. You know, that mom not being able to get a hold of that doctor or somebody on his team, or being simply told, you just come to the emergency room. That's unacceptable. That's garbage. I don't want to buy it anymore. I'm not going to buy it anymore. You shouldn't buy it anymore either. There's better ways of doing it. You know, we're the enemy, right? I've discovered the enemy, it's us, right? We're the buyers. So North Carolina, Medicare in North Carolina is now in its 6th year, 44% reduction in asthma in the Medicaid population, right? Just a modicum, just a hint, just a whiff of coordination of care, right? So for every $1 you invest in care coordination, according to the study that came out of Vancouver 2 months ago, you save 85 as a company. Because you're keeping patients out of the emergency room, you're keeping them out of the hospital. That's the expensive places that you want to keep them from. But it's not only a great value proposition for you in terms of money, the hospital and the emergency room isn't a place your patients will want to be. I don't want to be there. I don't want my family there. So again, this is the Geisinger journey. This is Vermont. IBM happens to be, again, the largest employer there. We worked closely with Governor Douglas in a statewide initiative. We now have close to half of our employees in a medical home there, as we do in the Hudson Valley, as we do in Arizona. And we're seeing an 11% decrease in cost in those populations. 11%. That's bending the cost curve. Mayo Clinic, right? Great clip. And again, if you remind me, I'll send that to you too. On ABC News. It said, even the world-famous Mayo Clinic, it starts off, needs primary care. They discovered that their own employees, just as Bellin has discovered, and they've developed a plan for their own employees, right? Just like you should be doing. Their own employees were costing them a bundle of money, and when they looked at that, it was from unnecessary emergency room visits and unnecessary hospitalization because nobody was coordinating care. So they and IBM, because we're the two largest employers in that community, set up medical home there for our population. And in 3 years, we've seen a 0 cost increase in 3 years. The country's seen a 36% cost increase in that period of time, and it's been 0 for us, right? 0. This is minus 11%. I mean, why wouldn't you want to buy that? Why would you want to go back to the health care plan and say, you know, sell me the crap you sold me last year? So we're not. So this is what we're seeing again across the country overall in these pilots. This was presented at the White House last August, so it's a bit dated, but the average reduction was 17%, pretty consistent. Here's the problem is that we only have one lever. We only have a lever that's fee for service. We only pay fee for service. If you only pay fee for service, what are you going to get? You're going to get too many services. And by the way, you know, we put pressure on people. We squeeze, you know, we tell the healthcare plans, we say, you know, please take cost out. And what do? They go and squeeze the community to try to lower the cost. Who's squeezable? Right? The large orthopedic group isn't squeezable in town. You know, the private primary care docs are squeezable. So you squeeze them, you know, and what do? They get another job as the CMO of the hospital, right? Or they leave town. And then what you're left with is a buyer. You're left with your patients. Now, instead of going to see a primary care doc for their sore throat, they see an ear, nose, and throat specialist. And what's the cost differential for that, right? For us, it's $57 versus $670, right? I mean, so, you know, you save money for about a month. I mean, it hasn't worked very well for us, has it? I mean, you know, we've been doing that play now for years as companies. We go to the healthcare plans, we go to our brokers, and we say, you know, you got to take cost out of this, right? Without thinking about what the consequences of that are. I mean, there's only so many people that are squeezable. They squeeze those people, you know, and it just pops up somewhere else. So we noticed in Reading, you know, we squeezed Reading and we said, you know, we're going to make you reduce the cost. Well, they reduced the cost all right, but our overall cost went up because they just did more procedures. So we moved.